This is a presentation of prescription coverage options available to persons who do not have a drug plan. If you do not have a medical plan through your work, or if you cannot be added to your partner's plan, then there are some options available to you. In this session, we will review the types of coverage you may qualify for. These include emergency coverage and Alberta government plans. For those of you who are 65 years of age or over, an overview of the Seniors Blue Cross and the Senior Special Needs Assistance Program will be given. The 24-hour Emergency Income Support Contact Center can provide immediate assistance for emergency prescription needs. The intake worker will ask you many questions to find out if you qualify for this program. Emergency coverage is seen as a last resort. Therefore, you are expected to use all means available to try and pay for the prescriptions yourself. If you have no money to buy your prescriptions, then call the contact center. But before you do, have the following information ready to help prepare for the interview. Explain the urgent need for your medication request. Examples of situations would be that you are diabetic, or that you have a mental health diagnosis that is controlled by medications, or you've been given a prescription for antibiotics but can't afford to buy it. List the income from all the adults living in the home that rely on you for financial support. Write down what you currently have in your bank accounts and in your partner's accounts. This includes both checking and savings accounts. What are your monthly expenses? List what you are being charged for monthly rent or mortgage, utility bills, transportation costs, monthly insurance, grocery bills, and the like. If approved, they will want to know the name of the pharmacy you go to, so have their phone and fax number ready. If approved, you will be covered from the day you called until the end of the month. It is not considered ongoing coverage, so it will not be renewed for the following month. Sometimes, however, if you call back the next month, they may grant you another month. It's worth calling to find out. It will help your case if they know you've applied for ongoing coverage, such as through your place of work, the Alberta Adult Health Benefit Plan, or the Blue Cross Non-Group Coverage Plan. I'll be speaking about these plans shortly. As noted on the slide, there are 3 options to connect with the 24-hour emergency contact center: by telephone, fax, or email. They are open 24 hours a day, 7 days a week. The Alberta Adult Health Benefit Program supports Albertans with low income to ensure they have access to prescription drugs, dental services, optical services, emergency ambulance, and diabetic supplies that are essential to health and well-being. It is available to Albertans in low-income households who are pregnant or have high ongoing prescription drug needs. This plan includes children who are 18 or 19 years old if they are living at home and attending high school. If you or your partner have coverage through another plan, but you can't afford to pay your co-payment share, then the Alberta Adult Health Benefit Plan may cover it. You still must meet their income eligibility limit. This program provides coverage for prescription drugs, essential over-the-counter medications, essential diabetic supplies, dental care, eye exams and glasses, and emergency ambulance services. To be approved, you must have filed the last year's income tax, as your eligibility is based off of your income tax information. You must live in Alberta and be a Canadian citizen or have permanent resident status in Canada. And you must be low income. Check out their website as it shows the maximum income guidelines based on family size. There is an application you must complete. You can find it on their website, or you can call their office to have it mailed to you. Once you've filled it out, signed, and dated it, then you can either mail or fax it in. If you have last year's notice of assessment from the Canada Revenue Agency, send it too, as it will shorten the assessment time. If you are unable to provide it, the program will contact Canada Revenue Agency to obtain a copy. If you are approved, you will receive a card. It's valid from October 1st to September 30th of the following year. It is reviewed yearly, and if you remain low income based on your income tax return, your coverage will continue. If you know your income will be too high to qualify again, then consider applying for the Blue Cross non-group coverage plan. And if denied, you can request they reassess your income. Further details are on their website, or you can call them. Visit their website to understand all that is covered and for their application form. This slide lists their contact details. Alberta Income Supports provides low-income Albertans with monthly income prescription coverage and some other benefits. You must meet their income eligibility limits to qualify. You can apply online, or you can call them to speak with a worker who will assess your situation over the phone. The process can take 5 to 8 business days for approval. Alberta Blue Cross non-group coverage. I stress non-group as this is a government-sponsored plan. Unlike other Blue Cross and private plans that do not cover persons who have pre-existing medical conditions, this plan does, with no questions asked. To qualify, you must be under age 65 years of age and have a valid personal health care card. Coverage is immediate if you apply within 30 days of your previous drug plan ending. Otherwise, you will have a 3 calendar month waiting period before you can start using their card. The plan covers prescription drugs, diabetic supplies, ambulance service, as well as other benefits. Please refer to their website for the full list of benefits offered. The plan covers 70% of your prescription cost. You are responsible for 30% to a maximum of $25 per prescription. Premiums are billed quarterly. You do not pay for the 3 calendar month waiting period. If you fall behind on payments, your Blue Cross will be canceled until such time as your debt is paid. And a note for those of you who are under 65 with a partner over 65 years of age. You are to apply as a single person and will be billed as a single person. Your partner will be covered under the Free Seniors Blue Cross program. You can apply for coverage by downloading their application form from their website, or you can call their office to have it mailed out to you. The Seniors Blue Cross program is provided by the Alberta government. They provide seniors with premium-free coverage for prescription drugs and other health-related services. It does not provide travel insurance. You can apply for coverage at your local registry office, but call first or check the Seniors Blue Cross website, as not all registry offices provide this service. Please bring acceptable proof of age documents. This includes Canadian driver's license, an Alberta identification card or birth certificate, an old age pension entitlement form, a passport or immigration record, or a Canadian citizenship certificate. You can review information about their program on their website, or you can contact them by phone. Seniors with low income may qualify for financial assistance through the Special Needs Assistance for Seniors program to help cover the 30% co-payment share of their prescription cost. To be eligible for this program, you must be 65 years of age or older, be an Alberta resident, be a Canadian citizen, or have been lawfully admitted to Canada for permanent residence, meet financial eligibility criteria, and have provided a seniors financial assistance application. This form can be found on their website, or you can call them to have one mailed out to you. To be eligible, your primary income threshold is $29,285 for a single senior or $47,545 for a couple. Benefits are provided for the current benefit year only. Over-the-counter medications and medications not on the Alberta drug benefit list are not considered. Funding is provided for the co-payment amount you pay above the average of $45 per month for a single senior, or the senior in a couple where one individual is under the age of 65, or $90 per month for a couple where both individuals are age 65 or older. When you've received your approval letter, you can submit your receipts and documents online, or you can mail or fax them. If you've been denied, you can appeal the decision by contacting the number on the slide. This slide lists Special Needs Assistance for Seniors website, phone and fax number, and their mailing address. This concludes the review of medication coverage for urgent needs, government-sponsored programs, including Seniors Blue Cross and Seniors Special Needs Assistance Program. Do you need more help? If your doctor is part of a primary care network, you can request a referral to a social worker for information, direction, or assistance in completing forms. A PCN pharmacist may also be able to assist. You have the option to speak to your local pharmacist, or you can contact 211 for assistance.